Hello, everyone. This is my presentation on the National Patient Safety Goals and Emergency Preparedness Plan. So, what are the National Patient Safety Goals? These goals help establish the standards of ensuring patient safety in all healthcare settings. Healthcare facilities focus on preventing sources of patient harm while also regularly revising the goals based on their effectiveness, the impacts, and cost. These goals help promote health equity, help prevent both for patient and staff hospital acquired infections, medication errors, and all forms of clinical harm, including falls. In the context of a pandemic, the goals help healthcare facilities develop strategies and protocols to prevent the spread of infectious diseases, protect both the patient and the staff, while also maintaining the continuity of care. These goals are designed to address all the unique challenges and the risks that may arise during emergency situations. Now, for the COVID-19 background of the United States, this is all based off the CDC, and this is all dated up to, as of right now, December 10th, 2023. The total amount of cases that have occurred during the first ever case, which happened in January 3rd of 2023, up to now, the total cases have amounted to up to 103 million. Total hospitalizations are between 6 and 6.5 million. Total amount of deaths range from 1 million to 1.2 million. People who were vaccinated with the first dose amounted up to numbers of between 270 million people and 280 million people. And between that same population, people who were fully vaccinated have amounted up to the 230 million mark. So when it came to managing COVID-19, the hierarchy of control was applied to help mitigate the spread of the virus. The hierarchy of control was a framework that was used to prioritize and implement measures to minimize the risks. We can see by the image that it goes from the least effective methods to the most effective methods. So framing around the hierarchy of control, the least effective methods were the PPE, also known as the personal protective equipment, which included masks, gloves, or anything that was used as a last line of defense. The second level of the hierarchy was the administrative controls, which these controls focus on implementing policies and procedures to reduce the risk of exposure. These included screening protocols, regular testing with the method of the nasal swab, and also promoting good hygiene practices such as hand washing or mask wearing. The third category was engineering controls. These controls help modify the environment to reduce the risk of transmission, which was passing the disease from one person to another. Examples were used such as physical barriers, improving ventilation systems, and also implementing social distancing in public spaces. The fourth level was substitution. Substitution involves replacing high-risk activities for the environment with lower-risk activities. For any faculty member or student who went to school between the years of 2019 and 2023, we've seen a lot of activities in school, including like attending school, go from being in-person gatherings to reducing it down to being having the classes be online and having virtual meetings instead. And finally, the most important goal for COVID was elimination, which was eliminating COVID-19 as quickly and as efficient as possible. Even though COVID-19 is still prominent, is still here, the main measures that were achieved to reduce the amount of people who have the risk of getting COVID-19 included achieving lockdowns, travel restrictions, and quarantining. So again, as the CDC stated, that this was the COVID-19 emergency plan when it was first implemented in 2020. So one of the first major steps of the plan was contact tracing, which was tracing and monitoring the contacts of people who have tested for who tested positive for COVID to prevent further spread. Testing and diagnosis ensured that widespread access to COVID-19 testing and accurate diagnosis was identified, and it could help allow people isolate the infected individuals. Public health messaging provided clear and accurate information to the public about COVID-19, preventing measures, and also updates on the situation. Vaccinations, with the vaccination campaign, it allowed facilitation the distribution, and the administration of all COVID vaccines to protect individuals and communities. Travel restrictions and border control implemented measures of controlling the movement of people across the borders to prevent the spread of the virus. And according to law in an article produced in 2020, 2022, healthcare system readiness, which is strengthening healthcare systems to handle the influx of COVID-19 cases, ensuring sufficient responses, personnel, and equipment. So one of the main things for a healthcare administrator to help develop and implement an emergency preparedness plan is having the actual following steps to help produce the best sufficient and efficient plan. So the plan that I produce involve assessing risks, developing protocols and procedures, communication and education, collaborating with stakeholders, maintaining supplies, viewing financial costs before, during, and after an emergency plan and emergency response, evaluation and improvement, and finally the emergency response itself. So the implications for a health administrator developing an emergency preparedness plan are very important. First, it helps ensure the safety and the well-being of all staff, patients, and the community during these emergencies. It also helps effectively coordinating and communicating with various stakeholders such as healthcare providers, emergency responders, and community partners. Having this form of a solid plan can also help enhance the overall response and recovery efforts, minimizing potential disruptions and continually ensuring the continuity of healthcare services. So again, the first step is the risk assessment. According to Guerre and Ganoli in 2023, one of the main subcategories within the risk assessment is identifying the internal and external factors, also known as hazard identification. Identifying potential hazards such as natural disasters, earthquakes, floods, hurricanes, technological emergencies, which also include chemical spills or power outages or COVID, or man-made emergencies such as terrorism or acts of violence. The next subcategory is the vulnerability assessment, assessing all the vulnerabilities and the weaknesses of the community or organization in relation to the identified hazards. This may include evaluating resources, the capacity to respond effectively, or just mainly infrastructure. The third subcategory was the impact analysis, evaluating the potential consequences and impacts of each hazard, considering factors such as property damage, economic loss, disruption of essential services, or human safety. Probability assessment is estimating the likelihood of each hazard occurring based on historical data, scientific analysis, and expert opinions. And finally is the risk assessments, using all the identified risks and evaluating them based on the severity and the likelihood of them occurring. This helps determine the level of risk associated with each hazard and guides decision-making on each hazard and how to mitigate or manage these specific risks. After evaluating the risk, appropriate measures are put in place to treat or reduce the identified risks, also known as risk treatment. This can include implementing safety protocols, provide training, improving communication systems, or just enhancing security measures. So when it comes to developing protocols, one of the first protocols I looked at is emergency response. The emergency response outlines the steps that should be taken during these types of emergencies, such as natural disasters, fires, or medical emergencies. They provide the guidance on how to initiate emergency response, evacuate if necessary, and how to communicate with relevant stakeholders. Communication protocols, these allow and establish clear lines of communication during emergencies. They define who should be contacted, what information should be shared, and what types of communication channels should be used, like two-way radios, phone systems, any form of technology. Evacuation procedures are protocols that outline the steps to be taken when it's necessary. These include evacuation routes, assembly points, and methods of accounting for all individuals. They also address the needs of the vulnerable populations, such as people who have issues with mobility or children. The shelter in place outlines individuals staying indoors. This could be for reasons such as hazardous conditions, hazardous materials being released into the atmosphere, or an active threat in the area. The main purpose of the shelter in place is to provide protection and minimize exposure to the potential dangers outside. The incident command structure establishes a hierarchy structure for decision making and coordination during emergencies. It designates for specific roles and responsibilities to different individuals or teams. It ensures efficient management of resources and personnel. Medical response procedures, these protocols detail the actions to be taken by healthcare providers in response to any medical emergencies. They may include administration of medications or just protocols of managing specific medical conditions. Patient identifying and tracking, these systems help implement ways of identifying and tracking patients during these emergencies. This helps ensures that the patients do receive appropriate care and are reunited with their families. The continuity of operation plans, these plans help ensure that essential functions and services can be maintained during these emergencies. The plan outlines strategies for backup power, data protection, relocation of critical operations if necessary. And finally, with the development of protocols and procedures comes with evaluation and improvement. Regularly evaluating the effectiveness of the emergency plan and the things that are involved with the emergency plan when developing protocols and procedures are necessary to make the changes based on the lessons learned from the drills and exercises or real life incidents. This helps the plan this helps enhance the plan's responsiveness and adaptability to changing with the circumstances. Communication for this plan is essential because it establishes a clear line of communication with faculty, staff, patient, the general public, and we can use communication to create communication channels or communication systems. Communication also relies on communication methods such as two-way radios, cell phones, or intercom systems to relay important information during these emergencies. And developing the communication plan involves contact information for key personnel, external agencies to ensure effective communication is relevant with relevant stakeholders. Education provides comprehensive training to staff on emergency protocols, including specific roles and responsibilities during different emergencies. Conducting regular drills and exercises to practice emergency procedures can also help reinforce knowledge. And also with education is the ongoing education and updates on the national patient safety goals with all changes in the emergency response to protocols to help ensure that the people, that staff, patients are knowledgeable and they remain up to date with all the changes that are always happening. So, with collaborations with stakeholders, the stakeholders include healthcare providers, emergency management agencies, government agencies, community organizations, and educational institutions, plus the general public. Each stakeholder brings a unique form of knowledge to the table, and it helps in identifying potential risks, developing response protocols, and implementing preventative measures. Collaborating with stakeholders relies on information sharing, which different stakeholders possess valuable information that can contribute to the greater picture, which is a more accurate assessment of the situation and informed decision making during the emergencies. And communication and coordination, collaborating with stakeholders help establish effective communication channels, ensuring that information flows smoothly between different organizations and individuals that are involved with the emergency response. Resource management. So a lot of healthcare facilities during this plan need to reinforce resource management as emergency medications and supplies are very important as healthcare organizations can and may stock up on emergency medications and other medical supplies to address immediate patient needs during emergencies. PPE, as stated before, includes gloves, masks, gowns, any form of eye protection that should be available to protect healthcare workers and patients during emergency situations. Emergency communication systems have reliable systems in place, such as, again, stated before, two-way radios, mobile devices that can help healthcare providers stay connected and coordinate their response during emergencies. And finally, with maintaining supplies, emergency powered sources. Backup generators or any battery powered equipment can ensure that critical medical devices that are needed and systems remain operational during power outages or emergency situations. So financial costs. So according to Clark and an article written in 2022, one of the main questions that are presented when it comes to the financial costs during an emergency preparedness plan is, are what are the projected expenses associated with a pandemic, and how can we implement each measure to increase surveillance, monitoring, and the procurement of all these materials. So one of the ways that could be done is by budgeting, allocating funds specifically for emergency preparedness activities such as purchasing emergency supplies, maintaining equipment, and conducting training exercises can be done to help not spend as much money as needed. Insurance coverage reviews insurance policies to ensure that people are adequately covered by potential losses or damages during the emergencies. This can also include property insurance, business interruption insurance, or liability. Emergency funds established to cover like unexpected expenses that may arise during an emergency. This can help with immediate response and recovery efforts. Grant funding explores the opportunities of financial assistance from government agencies or organizations dedicated to emergency preparedness. These funds can come support planning, training, or resource acquisition. And finally, cost analysis. Cost analysis is used to identify potential financial risks and prioritize investments in areas that have the greatest impact of the emergency preparedness. Because of these specific five factors, significant and continuous investment increments will enhance global health emergency preparedness. Slide 13 is about evaluation and improvement. So some of the ways that we can evaluate the effectiveness and the just the in general the emergency preparedness plan itself is through these four subcategories. Audits and inspections are conducted to assess compliance with the national patient safety goals and the emergency plans. This involves evaluating whether the protocols, procedures, or resources are in place and it meets the goals and ensures patient safety through these procedures. Performance indicators. A lot of healthcare facilities often establish specific performance indicators or specific metrics to track their progress in implementing these specific goals for the emergency plan. These indicators may include infection control, communication effectiveness, staff training, and patient outcomes. Staff training and competency assessment. These are training programs that are implemented to ensure that healthcare staff are knowledgeable about the HPSGs and also understand their roles and responsibilities during emergencies. These assessments may be conducted to evaluate staff members' understanding and the application of the emergency plan. And finally, patient feedback, which is a valuable source of information for evaluating the effectiveness of the emergency plan. Healthcare organizations can collect feedback through surveys, focus groups, or other forms of other methods that are able to assess and form patient satisfaction, perception and safety, and the overall experience of the emergencies. And finally, we have the emergency response. The emergency response is the implementation of the plan that takes center stage. The emergency response plan is not limited to the faculty level, but includes regional and national planning. So one of the main things about the emergency plan is that it is not the same as emergency response, as the emergency plan is the implementation is the development, and the emergency response is the implementation. However, both plan and response correlate with one another, as the emergency response implements the actual plan in actual action. So one of the ways to evaluate the emergency response due from the emergency plan is to also identify potential emergencies of the emergency response, assessing the types of emergencies that could occur in the area, such as public health crisis or security efforts. Developing a emergency response team, assemble a team of individuals with specific roles and responsibilities during an emergency. This team should include representatives from various departments, organizations in the response effort. Creating the emergency response plan. In order to do that, we have to develop a detailed plan that outlines the actions to be taken during different emergency scenarios. This plan should include the procedures of communication, evacuation, medical assistance, and resource allocation. For training, we have to make sure that all staff and all members of the response team receive appropriate training on their roles. Regular drills, exercises will help reinforce and enforce preparedness and identify the areas of improvement. Communication, establishing clear communication channels and protocols for sharing information and coordinating response efforts and team members, stakeholders, and external agencies. And coordinating with stakeholders, local government agencies, health providers, law enforcement, communication, community organizers, identify the roles and responsibilities that were identified in the emergency preparedness plan, and also identify them in the emergency response plan to establish mechanisms for coordination and collaboration. And finally, evaluation. This response is always periodically reviewed and updated to that specific preparedness plan in response of it, to incorporate lessons from the emergency response drills, exercises, and real life incidents. This this is my preparedness plan and emergency response. There we go. And here are my references.